centers right there in China just to take advantage of the speed.
Okay, let's unpack this for a second, because I know exactly what you are thinking as you listen to this. You hear faster, you hear bigger, you hear 10 million patients, and your brain immediately jumps to the phrase assembly line.
Right, the quality concern.
Yeah, it feels like they must be compromising on quality to push those numbers.
And that ingrained skepticism is actually the most common myth the report debunks. There's this assumption that a high-volume Chinese hospital means a doctor's attention is dangerously divided. The clinical data shows the exact opposite.
Oh, really?
Yeah. In complex modern surgery, high volume is actually the ultimate metric for safety.
You know, it makes sense when you think about it like choosing a pilot. Like, do you want the pilot who flies this specific route into a tricky airport once a month?
Yeah.
Or do you want the pilot who flies that exact route 3 times a day in every conceivable weather condition?
Exactly.
You want the pilot with the muscle memory.
Yes. Modern surgery is an extreme test of hand-eye coordination and split-second crisis management. You cannot learn how to navigate an unexpected arterial bleed from reading a textbook.
Right.
You only get that competence through reps. And the global medical community recognizes this. Take coronary artery bypass grafting, or CABG, which is open heart surgery.
Yep.
It is widely acknowledged that a hospital needs to perform a minimum of 415 of these surgeries a year for the surgical team to maintain the complex coordination required for maximum safety.
Well, I guess a lot of Western hospitals aren't hitting that 415 number.
Exactly. Because many less severe cases in the West are diverted to stent procedures, a lot of hospitals just don't reach that critical mass. The U.S. hospital average for CABG is about 317 a year.
So they're short of the safety threshold.
Right, but in China, the hospital average is over 416, safely crossing that global threshold. And if you look at individual surgeons, a U.S. cardiac surgeon might average 100 to 200 bypasses a year. A Chinese surgeon at a top center, like Fuwai Hospital, does 300 to 500.
The reps are just on a completely different level. And I was fascinated to see how this translates to the really high-tech stuff, right? Like the DaVinci robotic surgery systems. We tend to view the robot as the thing doing the surgery, but it's really just a highly advanced video game controller, right?
Spot on. People tend to fetishize the machine itself. But a robot does not have a brain. It is entirely dependent on the human hands operating the joysticks. And in the US, a doctor who performs 25 to 40 robotic prostate removals a year is officially classified as a, quote, high-volume surgeon.
Wait, 25 a year? That's not even one surgery a week.
I know. Now go to a top Chinese medical center. A lead surgeon there will perform 300 to 500 of those exact same robotic surgeries every single year.
Oh my God.
Yeah, they accumulate up to 3,500 over a career. So that dense muscle memory means they spend less time keeping the patient under anesthesia, they achieve millimeter-level precision when cutting around delicate nerves, and the complication rates just plummet.
And the orthopedic stats in the report reflect that exact same reality.
Yeah.